Hello, I'm Leslie Jenkins. Hope you can understand me. I've been sick lately, so I'm going to try to do this video. My video is going to be about the public health crisis of prescription overdose drugs. I've written down some facts that I'm going to read off, and then I'll talk a little bit on it freehand afterwards. But according to the CDC and American Public Health Association, one of the top 10 public health issues we are facing today is prescription drug overdoses. Death rates from prescription opioids such as oxycodone and hydrocodone have quadrupled since 1999. These are common painkillers that are given out almost like candy anymore. Between the years of 1999 and 2017, there were more than 700,000 drug overdose deaths. It is averaged that 40 people die each day. Some of the most commonly abused prescription drugs are opioid painkillers like Vicodin and codeine, depressants, anxiety meds and sleep aids like Valium and Xanax. There's even drugs that are used to treat ADHD that we give our children. Ritalin and Adderall, those are being misused. I know Adderall is commonly amongst college students and high school on helping them stay awake and do homework. This epidemic involves both men and women of all races and all ages. It is not specific and it is not targeting one in general. It's targeting everybody. Overdose death rates by state are West Virginia with the number one at 49.6%. Ohio is 39.2%. District of Columbia is 34.7%. New Hampshire is 34%, and Maryland 32.5% in death rates. That's the top five. Arkansas currently is ranking at 41 with 6.5%. The top five counties in Arkansas are Pulaski with 156 deaths, Benton County 87, Sebastian County 56, Washington 52, and Faulkner 40. Now, if you recall, these are just prescription drugs and opioids. HBO actually did a series in Van Buren County, which is Clinton, Arkansas, over meth. So not only do we have these prescription drug problems, but we have other drug problems too. Arkansas is one of 13 states that was awarded funding from the Prescription Drug Overdose Data-Driven Prevention Initiative. This initiative will help states advance their actions to address opioid misuse, abuse, and overdose. This increases their ability to develop strategies that impact behaviors driving prescription opioid dependence and abuse. Work with communities to develop more comprehensive opioid overdose prevention programs, and improve data collection and analysis around opioid misuse, abuse, and overdose. Prescribing has been singled out as the causative vector for our U.S. overdose crisis. Drug supply is a key factor, and the crisis is fundamentally fueled by economic and social upheaval. The etiology is linked to the role of opioids as a refuge from physical and psychological trauma. Poverty and substance use promotes operate hand in hand, and it's reinforced by psychiatric disorders and unstable housing. In poor communities, employment is dominated by manufacturing and service jobs with elevated physical hazards, including military service. Over years, on-the-job injuries give rise to chronically painful conditions. The counties with the lowest levels of social capital have the highest overdose rates. That's not ironic. People who have suffered trauma, PTSD, who are homeless, lack jobs, that's where they tend to turn to help their problems. That's their coping mechanism to try to make it through the day. If they're just not physically there or mentally there in their head, they feel as if it helps them cope and get through their life. Aside from the prescription drugs, structural factors like the lack of economic opportunity, poor working conditions and eroded social capital in depressed communities, along with the homelessness. As of July 12, 2019, Trump claims credit for the decline in opioid deaths, while public health experts caution he is claiming victory too early. They think he might actually be setting back public health efforts to rein in a broader drug crisis. I believe that there could possibly, hopefully, be a decline in the problem in the future because of these multiple initiatives that we are coming down with. The crackdown on overprescribing these. I know working in a hospital and on an ambulance, it has been, I have single-handedly seen it. Not the doctors are trying to crack down on it. They will call up at the ER and ask who is working to see if they can find a different doctor who has not seen them before to try to get prescription drugs for some ailment. I've picked up patients who have fake seizures in hopes that they will get a narcotic that we give to stop seizures. But once you talk to them and you tell them, look, we're not giving you this, they will sit straight up and quit faking their seizures. Or if the doctor in the ER, which I've seen multiple times, states, firsthand, before you tell me what's wrong with you, I'm not giving you prescription drugs, we've seen them walk out of the ER. So as long as this continues to happen, I think there will be a decline. I hope there will be a decline. I have single-handedly dealt with this firsthand in my family. I had a cousin who was on Ritalin as a child, who was prescribed or who was diagnosed with ADHD. They took him off of it cold turkey. He had withdrawals, and so he actually broke into a prescription a pharmacy to steal just Ritalin. Is all he wanted was Ritalin. Now that's a problem. If you break into a pharmacy and that's all you're wanting, that is a problem. We had a doctor in our county that is currently in jail right now that was prescribing too many medications to people, narcotic medications. He actually prescribed my cousin 90 Valium, and my cousin took the whole 90 Valium in 3 days. Now, I don't only just see this as a problem with our doctors, but I also see this as a problem with our pharmacies. I don't think that 90 Valium should have been prescribed and handed over to a 22-year-old male that had no medical history. I think that should have been caught by the pharmacist as well. My cousin did die. The doctor got a slap on his hand, and his medical license writing prescription was banned for 1 year. That made him mad, so he put a bomb underneath the guy over the medical department that took his license away for that and blew him up. The guy survived, but he did end up losing an eye, I believe it was. It's all over the news. You can Google it. But that guy's in jail right now. And there were multiple cases that came forward because of this. But I hope and pray that there is going to be a decline in this. There needs to be, for everybody's well-being, for families' well-beings. It takes a toll on everybody, not just the person that is suffering. Thank you.